Welcome to our webcast. This is the Quality Reviews webcast series, and I'm Ed Shin. I'm the CEO, co-founder of Quality Reviews, and we, for those of you who don't know us, help health systems, hospitals, clinics collect real-time feedback from patients for the purposes of improving the experience and service recovery. It is my pleasure today to welcome Richard Corder to our webcast. Richard is the president and managing director of Tier 1 Consulting and manages the healthcare division of Tier 1. So welcome, Richard.
Thank you very much. Good to be here.
It's great to have you. Really appreciate your time. Really, what I'd love to do is just dive right into it. You've got a interesting and unique background for folks who are kind of in this healthcare world. So I'd love for you to just share with us your background and how you got to Tier 1 Consulting.
Happy to. And again, thanks for having me, Ed. It's good to see you. So born and raised in the UK and in the hotel business. So the beginning of my career was spent pursuing what I thought at the time would be my whole career, which I think many of us do at that age, which is I thought I'd be a general manager of a hotel, and that took me from the Savoy in London ultimately to the Four Seasons in Boston, as a result of having attended a summer program at Cornell University, which is where I met my wife. And so I found myself at the Four Seasons Hotel in Boston, happily working away, tracking to be, I think, again, what I thought would be a general manager of a luxury hotel. And then I had an experience of being a patient at a large academic medical center in Boston. And that was, I think, what folks call your pivot. That was an opportunity to lie in a hospital bed for 5 days and see a different side of healthcare, and was left struck by, I think I remember saying to my wife, if we ran a hotel the way these cats are running a hospital, we'd be out of business. Of course, I now know that it's far more complex the proposition than that. And of course, as a non-clinician, I had no way of knowing all the stuff that you would know, Ed, right? I had no way of knowing the quality of the care or the accuracy of the care that I had to trust or that I had to assume. The things that struck me were just around how folks didn't seem to communicate with each other, and how work didn't seem to be standardized, and how when things did go wrong, it seemed to surprise people. But I could already see that this was on the path to not go to plan, or I would be transported to a department, and the department seemed surprised that I was coming. Or was about to do one procedure, and I was the patient lying there saying, hang on a minute, I don't think that's the procedure that I'm meant to be having. And upon review, oh, you're right. And it was a pivot to ultimately what then ended up being a summer convalescing from that hospital visit. And I never went back to the hotel business. I got then a series of operations jobs in healthcare, up to and including the senior director of service excellence, or what we now call the chief experience officer at that academic medical center where I'd been a patient. And I think that career or that path was in part right place, right time, right? So kind of hotel background, and then healthcare experience. Went to school at night and got a master's degree, so kind of got some of the ticket to ride into vice president type roles. And right place at the right time. It was a time when the everything was hitting around HCAHPS and value-based purchasing, and I think hospital leaders that hadn't previously thought about patients' perception of their experience, or patients being able to measure their experience, we're turning to folks that had this kind of weird background. Okay, they know the hotel business and they know healthcare. So I think I got a couple of jobs probably because of that. Ultimately left that job and joined CRICO, which is the medical malpractice carrier for all the Harvard institutions in Boston, fueled, I suppose, at some level by the crosswalk between patient, dare I say, patient satisfaction, or patient feedback, and when that does go awry and doesn't get responded to, ultimately what can become a malpractice suit. So really fascinated by that space of learning about safety and learning about high reliability and learning about learning from cases when they do go awry, and then using those learnings of how we might